I'm Andre Sr. at KTVU Fox 2 in the San Francisco Bay Area, and joining me now is Dr. Michael Hogue. He's the president of the American Pharmacists Association to talk about a lot about coronavirus and getting people tested and those antibodies, all the things that surround this. So, Dr. Hogue, thank you so much for joining us. First, let's start with the latest of what's going on in the news right now, and that is the testing for everyone involved, and that pharmacists will be able to administer the test. In fact, Health and Human Services has authorized pharmacists to conduct COVID-19 testing. So tell us what you know about that.
Yes, well, last week, the Department of Health and Human Services issued an advisement to the states that pharmacists, because of their dissemination in local communities, both in rural areas and in very urban areas, that it was essential that for us to improve access to testing, that pharmacists be authorized to order and administer COVID-19 tests, and that would include both the test for the virus and the antibodies as more rapid testing becomes available. And then each state will need to adjust their regulations to ensure that pharmacists have the authority within state law to be able to do that. But most states have already made that change and are ready to go.
So, a lot of people, we've heard a lot of this about not enough testing being done. So what makes this change by Health and Human Services better in terms of, okay, it seems as though we're going to have lots of tests now, but how is that going to happen since we don't have enough testing right now?
Well, that's a great point. The manufacturers of tests are rapidly trying to get those produced and are working with the Food and Drug Administration to add new testing capability that gives us results even more rapidly than we've had them before. And currently, because of the way that the healthcare system has had to rapidly adjust to the acute care of very, very sick patients with COVID-19, many of our outpatient services in healthcare have completely shut down. I mean, most of your doctor's offices now are doing telehealth visits. Most of your other outpatient services are unavailable for face-to-face visits. But the one healthcare entity that is open on a regular basis are still pharmacies. They're the one place that's still open as essential healthcare entities in addition to hospitals. And the reality is we can't test enough people through hospitals. We just don't have the system in place or the capacity to do it. So by adding pharmacies as locations where testing can be done, as the tests become more readily available, will really help consumers in every little town in America and every inner city area of the U.S. be able to more easily get tested. And I think that'll move us in a new direction.
So I want to understand this a little bit more, because I go and I get my flu shot at my local pharmacy, and I go in that little area, that little private area, and the pharmacist administers the flu shot. Is it kind of a similar setup in your mind when this does start to happen, that people will see this? I'm just trying to get folks an idea of what to picture in their mind as we look forward as to the day when we are going to get tested here.
Well, it's a great question, and I think there'll be lots of different models. I think it just depends upon the pharmacy and how they will do this. Of course, we will have to maintain personal protective equipment. Pharmacists will have to be appropriately gowned and gloved and masked in order to be able to do this, and we'll encourage consumers to continue wearing masks. That'll be very important. But, some of the testing could be done, for example, with self-administered swabs. In fact, one of the major national pharmacy chains just launched 4 locations in Pennsylvania today, where they're doing drive-through swabs, where the patient actually swabs themselves and hands the swab over to the healthcare provider, and then the provider does the test and actually conducts the test. And then some of these will be that you'll actually walk into the pharmacy, much like you do for your flu shot or your tetanus shot, and you'll have the pharmacist actually conduct the test right there in the pharmacy in a private location. So it's going to look like a lot of things. The main benefit, I think, and that the part that's is very exciting, is just the expanded access that we'll have to testing through pharmacies.
And I think a lot of people, that's the main thing. Hey, can I get tested? And can I just get tested to know if I have it? So I have to, in case I have to go around my parents or someone elderly, just so you know if you have it or not. So it's something that so many people are waiting on.
Yeah, and I think, Really where the advance is going to come is when we have more rapid antibody testing. Antibodies are the part of our bloodstream that tell us whether or not we've been exposed to an infection in the past. And so when we develop antibodies to COVID-19, it tells us that we are protected against COVID-19. And so probably more important than even the swab to tell us whether we currently have COVID-19 is the antibody test. And that's what we're really looking forward to. Once we have antibody tests, that's a game changer for all of us in America, because then we can go back to normal life a little sooner because we'll know if we have immunity or not.
Yeah, and I want to talk a little bit more about that particular thing, because lately, over the last couple of days, we've heard all about, this antibody testing, and these companies are ramping up and shipping out. Is it conceivable to you as a pharmacist that we would get the antibody testing first before we actually get the COVID-19 testing first?
Well, the COVID-19 testing is already available, and it's just a matter of the manufacturers ramping up capacity and being able to ship it out. So they're already there to the market, and it's just a matter of getting more of it to the market. Antibody testing, though, however, is where we will see the major shift in the way we can conduct our lives as Americans, because once we know our antibody status against COVID-19, then we're protected. And the other part about that is that we also know that COVID-19 vaccine is under development, and we're very hopeful that we'll have COVID-19 vaccine. And when you go in for your flu shot next winter, we hope that you'll get your flu shot, you'll get your pneumonia shot, and you'll get your COVID-19 shot all at the pharmacy and be fully protected against all of these infectious diseases. And that's our hope that's going to happen for this next winter. That's what we hope for.
Oh, but that's what everyone wants to know, because only then I think that we can see our lives really start to look like what it looked like before all of this unfortunately started, right?
Oh, absolutely. And I think the other thing that we as Americans have to realize is that, we've been very skeptical in America for whatever reason about getting our flu shot. Not a lot of Americans don't get their flu shot. I think one of the things we've realized here is that vaccines save lives. Had we had vaccine for COVID-19, we could have saved a lot of lives, but we didn't have the vaccine. It's under development. We lose somewhere between 20 and 45,000 people in the United States every single year from flu. And if every adult took influenza as seriously as we take COVID-19 and we got our shot, then we could prevent an awful lot of deaths from both infections. So I'm hoping that we'll have a major shift in the way adults in the United States approach prevention of infection in the future, and line up in the fall to get their shots from their pharmacist before the season hits.
I want to circle back to something you said before. You said some pharmacists have testing right now for COVID-19.
Yes, it depends on the state and availability, but there are, for example, as of today, at least a few pharmacies in Pennsylvania, which is a little closer to where the nucleus of the outbreak is happening right now. There are some pharmacies there that are doing testing even as of today. So it's different in different parts of the country, and so we'll see that expand across the country over time.
I want to ask you something, because I know a lot of people are wanting to know the question for this, because, as you know, so many people are out of a job right now. And the question is, if you don't have insurance, what do you see it looking like in terms of going in for testing? Right now, I have medical insurance for the flu shot. I can go in, and my particular health insurance offers a free flu shot. They give it away for free. How do you think this will look in the future for the antibody testing and COVID-19 testing with pharmacists?
Yes, that's a great question. The CARES Act provided the funding to cover the costs of testing. So the matter of being paid for that testing will be a matter between the U.S. government and the pharmacies, just like it's between the U.S. government and the hospitals right now. So, testing should be provided for all consumers for free. Now, as we expand into more in-depth antibody testing and the vaccine becomes available, I think that's something that Congress is going to have to address in future bills in terms of how we will pay for that for every person to be able to have access to both the antibody testing and the vaccine in the future.
The HSS, going back to the issue of the pharmacists taking care of things, HSS said, hey, these zip codes, these pharmacists are in the zip codes where these things are happening, so you can more pointedly treat the people, the areas that are having the most issue. Is that how they're seeing it? Is that how they've decided this is how it's going to be done?
Well, yes, absolutely. I mean, right now pharmacies are open and pharmacists are well trained to be able to do this activity. And the important thing here is the coordination of the healthcare team. Pharmacists and physicians work very closely day in and day out, even though they're not always co-located. Sometimes they are. But they communicate back and forth. And so a pharmacist can actually do the testing. And if a patient becomes positive, they can work very closely with the primary care provider of that patient to be able to ensure that they get referred into the right place in the healthcare system to get the right care that they need at that moment. And so this is a great way to really change the way that we look at healthcare in America to ensure that people have access in their communities to the care that they need.
So I want to get to this because I don't want to get everyone so excited because it's not widely available yet, but it will be. I mean, it looks like the federal government is working right now with organizations, your organization, to make sure it happens. But, conceivably, can you give the folks who are watching this a timeline of when we can expect to see this in their neighborhoods across the country? Because this will be airing across the country.
Sure. Well, that's a great question in terms of timing. I would say that by summer, you'll see this happening widespread across the country. I think that that's probably the timeline it will take in order for the testing to become widely enough available for it to be easily accessed in local communities. And that's just based upon capacity of production of the tests more than anything else. And we're looking to Congress to hopefully pass the bill within the next 2 weeks that will authorize Medicare to pay for the pharmacist-conducted COVID and flu tests. And so that'll close the loop on the backside now that HHS has authorized them to order it and conduct it. And so we're looking for those things to happen. So within 2 weeks, we'll hopefully have the infrastructure in place. And then by the summer, there should be widespread ability for patients to be able to get testing in the U.S. For COVID.
Well, that's you just mentioned something. In the next 2 weeks, you could have the infrastructure in place. That's things are moving along pretty quickly. It seems like. Am I correct if I'm hearing what you're saying correctly?
No, they are very quickly. I mean, the American Pharmacists Association is working diligently on national training programs to make sure that pharmacists are aware of the latest information about these tests, because every one of these tests that's coming to market, physicians haven't seen them before, pharmacists haven't seen them before, they're new. And so what we're doing right now is massive national education campaigns to help pharmacists understand. They already know how to do the testing and they're well versed on what to do in order to identify the signs and symptoms and refer for treatment. So they're ready for that piece. So we're doing all the education backlog and back work. And then we're working with state governments, local governments to make sure that all of the infrastructure on the back end in terms of regulations are in place. And then this last piece is Congress, and getting Congress to finally pass this last piece, which is payment for the pharmacists to be able to do this COVID testing under Medicare Part B.
I wanted to ask you, I mean, you are the president of the association that represents these pharmacists, but we have hundreds of millions of people here in this country. Do you have the infrastructure to deal with the number of people that are going to be coming in to get themselves tested, and it's likely going to be going on for months and months, if not years, of people constantly coming in and getting these COVID-19 testing, these antibody testings from a pharmacist? Do you have that infrastructure there ready to go?
Well, I think, being able to manage large volumes of people is a challenge for any segment of the healthcare sector, not just in pharmacies. I recall back to the H1N1 pandemic of influenza that we had many years ago. And as a pharmacist, I can remember having 100 people lined up outside of my pharmacy at 7 a.m. one morning, and we didn't open until 9, waiting to get a flu shot against H1N1 because we'd had a limited shipment in. We want to try to prevent, long lines and inconvenience. We want to try to do that to the extent that we can, but it's understandable that people are fearful. And I think that if we have this testing available more widespread, if you just stop and think about it for a minute, just in your area, how many pharmacies are within 10 miles of your area? There are a lot of them. And if half of them had the testing available on a ready basis, then those long lines wouldn't necessarily need to form, because we would have ready access in lots of places to be able to get the testing. And that's what the government's trying to do by working with pharmacies, is to disseminate the test availability so widely that we won't have to have these long lines and people searching for the test. It'll be easy to find.
And Dr. Michael Hogue, for the last, I wanted to get your final words here. What would you say to the American public? I mean, we have people who are going to be watching this from all over the country. What are your words to them as we march toward some sense of normalcy?
Well, the one thing that I would say is, we have a resilience in the American people that is just remarkable. And we're going to get through this. We are going to make it through this. And you're not alone. You have an army of people around you that are ready to walk through this with you and are walking through this with you. Don't let down your guard. The number one thing is, social distancing is probably something we're going to have to do for a long time. And maybe we won't be able to go back to the way things were 6 months ago for a while, but we will eventually. And the second thing is, prevent all the disease that you can, and then let's treat the rest. And what that means is, whenever there's a good opportunity to prevent an infection, let this be a lesson to us that we need to prevent it. So, get your annual flu shot, get your tetanus booster if you haven't had it, get a pneumonia shot if you haven't had your pneumonia shot. And of course, when COVID-19 vaccine comes out, get the vaccine. Don't hesitate to get the vaccine. By doing this, we not only protect ourselves, but we develop herd immunity that allows us to protect the most vulnerable in our population, because then we're immune and can't spread it to them. So it's a wonderful thing that we have these vaccines available, and that's why we need every person to take getting vaccinated as an adult seriously. It is not a light decision. It's a critical, important decision for our entire society.
Dr. Michael Hogue, President of the American Pharmacists Association, thank you so much for your insight. And we are getting very, very close. We're marching toward some resolution and getting our lives back to normal. And thank you for your insight as we head in that direction right now.
Thank you. Thanks for the opportunity.